Now, the other drugs that have become available in their phase 3 trials that have demonstrated a decrease in the onset of skeletal-related events include 2 oral hormonal agents, and that would be abiraterone, acetate, as well as enzalutamide. And we also see the delay of complications of bone metastases and their sequelae with radium-223. In radium-223, in their labeled indication, we say it's a delay of symptomatic skeletal events. And I think that's actually kind of cool, because the difference between a symptomatic skeletal event versus an SRE is that in the SRE, you could have had documentation of an asymptomatic fracture that was just gotten on a regular routine X-ray documentation. In the studies that led to the approval of radium-223, or demonstrated its value in a big international phase 3 trial, which not only showed its survival benefit, keeping patients alive longer, but it delayed symptomatic skeletal events. So it looked at the most common SSE was the need for palliative radiation for painful bone metastases, prevention of fractures, prevention of surgical intervention, and cord compression. Well, they didn't follow out for just asymptomatic incidental fractures, which was part of the SRE literature, especially with denosumab and zoledronic acid. But the real big important point, I think, is that with radium-223, so not only did it have a statistically significant delay in the SSEs, the symptomatic skeletal events, but this is the first bone-targeted agent that actually improves survival. So it was on the basis of that, and other radiopharmaceuticals were looked at and have never in a phase 3 trial demonstrated survival benefit. And radium-223 has now in what's known as the ELSIMCA trial. I'm really proud of the fact that just this month in April of 2015 in urology, people call it what's known as the Gold Journal. There's an article that I have published, and it's called Radium-223, the Urologist's Perspective. And in it, I give my experience with radium-223. I was involved very early on with the early access program, so we were able to get our patients onto therapy very early. And in addition to that, once the radium-223, which is commercially known as Xofigo, was approved by the FDA, my site in Myrtle Beach, we were the first site to actually administer it worldwide. So we were proud of that. So since that time, we've used radium-223 first and foremost for its life prolongation effect. It prolongs survival. And in the study, we saw the median overall survival of improvement for patients with castration-resistant prostate cancer. And it included all comers of either before chemotherapy or after chemotherapy. So interestingly, about 55% of the patients in that study had received chemotherapy, about 45% had not. And the totality of the median overall survival was 3.6 months. Now, when we went back and we did a retrospective analysis of the 45% who had not received chemotherapy, and they were deemed, they either refused it, they didn't want chemotherapy, they could have had it, or the doctors who were treating them globally said, we don't think they could tolerate it. But when we looked at that group, their median overall survival was 4.6 months. In the post-chemotherapy group, and again, this is post-hoc retrospective analysis, it was 3.1 months, which makes sense. And patients with more advanced disease, more therapeutics, post-chemotherapy, probably some higher tumor burden, would be further along in their disease spectrum. But the take-home message for me is, as a urologist or a medical oncologist or radiation oncologist, is the importance of identifying patients earlier on to get the benefit of the therapy.